Cancer that forms in the tissues of the prostate is responsible for over 32,000 deaths of men in the United States each year. Dr. Asif Forsolia of Orange County CyberKnife discusses prostate cancer and talks about a new treatment called CyberKnife.
Prostate gland is basically part of the male reproductive system. It's a small gland the size of a walnut, lies directly in front of the rectum, and has the bladder on top of it with the urethra running right through the center. Its primary function is basically it serves as an exocrine gland to produce seminal fluid that is secreted into the semen. Prostate cancer is essentially cancer that develops in this gland, and it's normal glandular cells that start replicating out of control.
What are the symptoms of prostate cancer?
Most prostate cancer actually doesn't present with any symptoms at all, unless it's in advanced stages. Sometimes people can get obstructive urinary symptoms, like trouble urinating, frequent urination, blood in the urine, things like that. Sometimes people get bone pain in more advanced stages. The vast majority of people currently in the United States present with an elevated PSA, which is a type of blood test. The other way is physicians pick it up on normal screening exams by doing a digital rectal exam. Those are the most common ways that people tend to present.
What are the treatment options?
So the treatment options vary, and that's one of the most important things to understand about prostate cancer is that it's a spectrum of disease, and so likewise there's a spectrum of different treatment options depending on the aggressiveness of the disease. But they can include things, with low-risk disease, even just observing the cancer and not even treating it at all, to various types of surgical techniques. There's a number of different radiation techniques, as well as brachytherapy, hormonal therapy, and then of course some promising new therapies such as CyberKnife.
Just what is CyberKnife and how does it work?
The CyberKnife is basically a miniaturized linear accelerator that's mounted on a robotic arm. And essentially the patient comes in and lies flat on a sort of hard table and has this robotic machine. It can come in literally thousands of different angles, and it uses hundreds of different beams that intersect directly on the prostate gland itself. And it takes advantage of the fact that the contribution of each individual beam is just 1/100th, but where they intersect, it can deliver a very high dose. And within a few millimeters away, you can have very sharp dose fall off. The typical patient will come in and have fiducial markers, small gold seed markers that are placed directly into the prostate gland to track the motion of the prostate. Then they come in and they do what's called a simulation, where we plan the radiation treatment out. Then we have a team of physics staff and dosimetrists who design a customized plan for each individual patient. Then the patient comes and they start their 4 to 5 treatments. Each treatment, like I said, lasts only about an hour to an hour and a half. And usually it's given every day or every other day. And so they can be done within a week to 2 weeks.
I had surgery about 3 years ago and had my prostate removed. But on various tests, the PSA showed that there was still some cancer remaining. I've had 2 checkups since I've had the radiation with my oncologist. And my PSA has moved from 6.9 to 1.2 to 0.9. So we feel like it's been very successful.